Okay, let's see. First question, what do we got tonight? What would be the best treatment, type of light, time, and distance from the skin to heal chronic inflammation in sinuses and difficulty to breathe properly? So the best treatment for your sinuses is just exposing your sinuses to red light therapy. So that's actually a common theme for all the different treatments within red light therapy. Is the most important thing is just to expose that part of your body to the light. So the sinuses can be pretty tough to get to, but what I recommend is the Target Light 2. This is probably the easiest light to use on your face because obviously you can just hold it in your hand and you can position it near your sinuses. So what I recommend is that you just kind of hold the light around your nose. I've got my blue blockers on, so it's difficult to get there. But you can hold the light directly on your nose. You can hold it kind of on your cheeks to the side. You can even hold it on the side of your head because we know, of course, the sinuses are all connected. And there are some systemic, there's a lot of systemic benefits to red light therapy. So even if you're holding the light on the side of your head, it's still going to reduce the inflammation in your nose and your sinuses. And the distance from the skin, from the face, I would do in this instance, no more than 2 centimeters. You do want the light to penetrate, through the bone, into the sinuses, through the nose, through the skin. So about 2 centimeters away is perfect. And I would do only about 3 minutes per area. So 3 minutes there, 3 minutes there, and then 3 minutes on each part of the side of the head. I hope that answers the question. Next one. If I focus on healing a part of the body, let's say my shoulder pain, and I do the exposure twice a day, as far as I understand, too much exposure won't make things heal faster. That's a great point. When it comes to red light therapy, more is not better. Okay, and what do we mean by that? We mean that there's a certain principle of red light therapy called the biphasic dose response, which basically means when you start your red light therapy, the benefits tend to increase until you get to a certain point. I like to think of that as like a saturation point, as it were. Once your cells are saturated with the full complement of light that they're going to be able to absorb in that session, the benefits start to decrease. So the sweet spot with red light therapy is actually generally 5 minutes per area, regardless of which light you have and what you're treating. Okay, I'll explain a bit more about that a little bit later. So the question continues, is it better to first focus fully on one part of the body, and once it's fully healed, I can expose another part, or should I alternate? Or is it 20 to 30 minutes max per zone, and I can treat all parts every day? Okay, so there's a couple of things here, so this person is saying, should I treat all parts every day? Now, this is an interesting question because if you've got multiple parts of your body that you want to treat, so this person, I assume, wants to treat the sinuses. He or she also mentions they want to treat shoulder pain, and then they go on to discuss other parts of the body that they would like to treat. Now, you can do all of that with a target light, okay? So I would do the 3 minutes, as I was saying, on my face, maybe the side of my head. Then I would move to my shoulder. I would do 5 minutes on the front of the shoulder, 5 minutes on the side, 5 minutes on the top, depending where you feel the pain and how severe it is. And then I would move to a third or fourth and even fifth part of the body. And again, I would do 5 or so minutes, just targeting whatever part I'm aiming at slightly different angles. So you could probably do a maximum of 15 minutes per area. Not on your face though, but the rest of your body. I would say a maximum of 15 minutes per area over 4 to 5 areas. If you have more widespread problems than that, then I don't think this will be good enough. I think that's when you need the bigger panels. So with the bigger panels, it's still 5 minutes per area, but you can get your entire arm, or you can get your entire leg, or you can get your entire torso. So you're getting the whole part, that whole part covered in red light therapy in the same 5 minutes. So you don't, if I was doing every part of my body with this, It would take me an hour and a half, 2 hours. So if that is you, if you've got multiple parts to cover, consider getting a bigger panel. I heard you can hit a plateau when daily exposure. So is it better to take breaks every 2 or 3 days? What would be your insight on this? Yes, that is true for some people. I guess it's like exercise, you can't really lift weights every single day. You do need time you need to give the body time to recover and to repair and to actually do the good work that the red light therapy is doing. I do know a lot of people that do red light therapy every day. They love it and they swear by it. So you can do that. I do also know some people who take some time off. So again, that is absolutely a possibility for you. There's no strict rule when it comes to red light therapy. It's not black or white. It's not one way is the right way, this way is the wrong way. Interestingly enough, the scientific studies very often show great results with all different ways. We get great results with very short treatments with very low power. We get great results with very short treatments and medium power. We get great results with long treatments and low power. So, everything seems to be working, so that at this stage, there is no strict one way is better than the other way. Does it help with neuropathy pain, neuropathic pain? Yes, absolutely. I've heard incredible stories from many of my clients with all kinds of pain. And that's actually what I'm most excited about when it comes to red light therapy is the pain relief. There's a ton of other benefits, of course, with red light therapy, but with pain, I've seen simply fantastic life-changing results from our clients. I've also seen life-changing scientific studies. So, whether we're talking about the science or we're talking about real-life results, I've seen it all. Red light therapy is fantastic for all kinds of pain. So the answer is there absolutely yes. How long should a treatment be required to treat eczema or psoriasis? For those skin conditions, again, anywhere from 5 to 8 minutes. But there's something very important that's worth talking about now, because I've got a feeling this question will come up a lot. The most important thing about red light therapy, of course, you need a device that's powerful enough. But that's not the most important thing. Most brands these days have devices that are powerful enough. Some brands are fixated on getting the most powerful red light therapy device man has ever seen. And that's simply not necessarily. You don't need a red light therapy device that's much stronger than the sun. When you get up to those crazy high intensities, you could argue it's not natural, because nowhere throughout, human evolution have we been exposed to light more powerful than the sun. So it doesn't really make sense that it would be good for us. But that being said, the most important thing is actually distance. So in the context of eczema or psoriasis, it's a skin condition. It's on the surface of the body. You don't need to be this close when you're, treating skin. Because skin is on the outside, it needs much less intensity, much less power, and therefore you can actually be further away. So when it comes to skin, I recommend, if it's on your body or your arms or your legs, you can be about 20 to 40 centimeters away for 5 to 10 minutes for your skin treatments. And if you are going for deep tissue benefits like pain, like muscles, like joints, like hormones, organs, anything on the inside of the body, that's when you want to get nice and close. I know there's a question coming up about can you touch the device to the skin? You absolutely can. In fact, I've got some hand pain the last few weeks, and I just balance the light directly on my hand like that. And I just do my 5-minute treatment like that. No need to hold it. I can play on my phone. I can do some journaling, do some reading, and I can get my red light therapy on the top and the bottom of my hand. I'll even hold the light like this, and it works absolutely perfect. So just to sum that up, if it's a skin treatment or a face treatment, besides the sinus one, see, it's a little bit nuanced. But to sum that up, if it's a skin treatment, you can be between 20 and 65 centimeters away. And if it's a deep tissue treatment, you can be anything from 2 centimeters to touching the skin for best results. I have the target light. How can I use this to help with hair growth? Okay, so assuming the hair growth is on the head, you simply expose the parts of the head where you wish to encourage the hair growth directly with the target light. So it does mean, unfortunately holding it like this, but again, you're only doing 5 minutes per area, so if it's the top of the head, 5 minutes per area there. Holding the light is not ideal, I will admit it, but these lights, as you can see, it's a normal light bulb fitting. So this means it'll fit into any standard household lamp. That's called an E27 screw socket. So that will screw into any decent lamp and will operate absolutely perfectly. The best one that I found the last time I did some experimenting was from IKEA, and it's called the Tertial. And what the Tertial is, it's a big kind of like articulated arm kind of lamp thing. You screw the bulb in and then you can position it any which way you want. And it seemed for me, I still use it, it's 2 or 3 years later now. I'm still using it, and it's more than strong enough to hold the bulb. And that would probably be easiest to get on the top of the head, because then you wouldn't have to hold it at all. It'd be completely hands-free. And with the head, you can actually be really, really close, because even though you want the hair growth benefits, you may as well get the brain benefits as well. And to get the brain benefits, you need to be basically touching the skull, because the light has to penetrate through the bone. So you need maximum intensity for the skull, and you'll hopefully get some great hair growth and some good brain benefits as well. Okay, so someone's saying, I have a handheld and I'm just not sure which is near red on the switch. Okay, so they're referring to the Target Light 2, and this has 3 settings, okay? The first setting is the combination of red and near infrared light, but you can only see red light, so it just looks red. But the first one is red and near infrared light combined. Then you switch it off. It's just got a simple switch. This one's not plugged in, but you just switch it off, switch it back on, and then it goes to red light only, okay? But it looks the same. So then you switch it off, you switch it on again, then it goes to near infrared light. And the near infrared light is a faint pink, or it's invisible, okay? I might see, let me show you quickly to make it simple. Okay, so let me rephrase that. The Target Light 2 has 3 settings, okay? The first setting is the red and near infrared light combined. But as you can see, I hope that's not too bright, it looks just red. Okay, then I switch it off, switch it on again. Now it's red again, but this time it's red light only. Okay, then I switch it off, switch it on again. Now this is near infrared light. So you can actually see on the camera there, it's got a very faint purple tint. This is the near infrared light. Now the trick is with this, after near infrared light is always the combo of red and near infrared light. So now switch it off. Now it's the combo of red and near infrared. Red again. Near infrared again. And then back to the combo. So it's always in that sequence. I know it's a little bit tricky to remember, but we do have plenty of content about that. So if you need to see it in writing, I can certainly make that available to you. Just reply to the email. Which setting should I use for my eyes? Okay. When it comes to eyes, it's not actually important whether you use red or near infrared light. They both have been shown in the science to have great benefits for eye health. The most important thing when it comes to treating your eyes is the distance from the device. Okay, again, if you're very, very close to the device, you're getting the maximum intensity that's coming out of that light. And the more you move away, of course, the light starts to get weaker. And so far from the science, what we know is that you need a very low dose of red light therapy for your eyes. So that means with our products, you need to be 65 centimeters away from the light and then gazing just in the general direction of the light. It doesn't matter if you're using red or near infrared light. I recommend using both as long as you're at that 65 centimeters, which is arm's length away, gazing in the direction of the light 5 minutes a day. That's perfect for an eye treatment. Another person's asking, I have the half stack 2.0. What would be the best approach to eyes health? Exactly the same thing. Regardless of the device, it's the distance that matters. Use red and infrared light, but as long as you're arm's length away from the device or even further. If you've got weak eyes and you find the red light is just too bright, no matter how far the light is, put it as far away as you need to, within reason, on the other side of the room perhaps, and just gaze in the general direction of the light. Let the light cover your face, get into your eyes. And with time, I've seen many, many people start to strengthen their eyes and start to, feel like their eyes are clearer and sharper and less aggravated. So it absolutely works. Specific uses of red light for aching joints. Combo, red or infrared. So for the deep tissue treatments, whether that's the aching joints, the muscles, the organs, the glands, everything else, the near infrared light is actually the one that goes into the body. So generally speaking, red light is just kind of surface treatment. It's for the face, the skin, the eyes, the hair. And the near infrared light is what goes into your body, into your bones, into your muscles. It penetrates the deepest, and that's the one that's going to be most beneficial for your aching joints. So to answer your question, I would still use both red and infrared together. But if you must choose, you choose infrared because that is the most beneficial for the aching joints. And when would you only want to use infrared? And the answer to that is, let's say I'm doing multiple treatments with this or any of the other devices. Eventually, it does start to warm up because it is very powerful. There's a lot of energy moving here, so it starts to warm up. And then after a while, it's just uncomfortable to hold it on your skin. It's too hot. Then I switch the red light off and I use only the near infrared light because it's much, much, much cooler. And that way you can continue to do your treatments if you need to do multiple treatments or if the device is getting too hot for you. What light to use, how long. So I'm not sure if this gentleman, Brian, I'm not sure if you're referring to which actual model, but I have just answered the question about whether red or infrared. Any model will do. Okay, I think Brian goes on to say he's got knee pain. This is one of the easiest ones for knees, and the other one is our flexible wrap, which is actually made for pain. So if it's only the knees you're focused on and you absolutely want the easiest device to use for your knees, get the Pango pad, because you can sit on the couch, you can straighten your leg, you wrap your knee up, you switch it on, you sit back completely hands-free, you just enjoy your time. With this is slightly more powerful than the Pango pad, but it's a little bit more cumbersome to use because as you can tell, you're going to have to hold that on your knee, move it around. You could put your leg up and kind of balance it, but it can be a bit tricky. So the easiest one is the Pango pad. This one is slightly more powerful, but requires a little bit more commitment. Can you use it where you have metal implants? Yes, absolutely you can. That's no problem at all. I've got a question here from, looks like Marcia. Does your red light help lymphedema? Does it help neuropathy? Does it help heal tendinitis? And the answer is yes. It helps everything, okay? And I know that sounds a little bit too good to be true, but the reason it helps everything is because it might not directly help the condition or the problem, but it helps the body look after itself better. Okay, so in the context of pain or tendinitis or the lymphedema, it's, well, I guess in the context of pain, it's helping the body take care of the pain itself. It's helping the body heal from whatever is causing the pain. So in the tendonitis, if it's an overuse or an injury, it'll help the body actually heal from that problem. So it's, it's kind of a philosophical question. It's not clear whether it helps the tendonitis or it helps the body heal the tendonitis. But that's one of the reasons why it does help with everything. So lymphedema, I can't really comment on a case-by-case basis. There can be so much going on there, underlying conditions, whatever. What I can confidently say is it'll improve your quality of life. It might not solve all your problems, but it'll decrease your pain. It'll give you more physical energy to get up and do stuff. It'll give your body more energy to do its thing, to heal and recover and to do its own, biological processes. So that is one thing I can promise you. Is it okay to have the light touching the skin? Yes, absolutely fine. Provided you're aiming for those deep tissue benefits, like you're aiming for the joint pain, the muscle pain, the organs, the hormones, the kind of internal benefits. It's perfectly fine to have the light touching the skin. It does get hot after a while, so you just have to be, wary of that and manage that, but that's not a problem. Has the light to be used every day to see an improvement? Yes. Yeah. I mean, look, depending, what you're suffering with. Mary hasn't really said what she's suffering with. So, as I said in the beginning of the call, I know plenty of people that use it every single day and swear by it. And I also know people that give themselves, 1 or 2 days off in between as they go, just like, an exercise program, for example. They give themselves a little bit of time off here and there. So, yes, use it every day or use it with 1 to 2 days off between. Let's see. Edward's got some questions here. Can you recommend a device to help pain relief from degenerative spondyliosis? Spondyliosis thesis. I'm not sure if that's a spelling error or my reading ability. So pain relief is, so let me say that again. Pain relief is one of the most exciting things when it comes to red light therapy. And I've seen fantastic results with so many people, with so many different kinds of pain. That's what I'm most excited about when it comes to pain relief, when it comes to red light therapy. So yes, there's a huge chance, Edwards, there's a huge chance that the red light therapy will help you with pain relief. It's not condition specific. So it doesn't matter what condition you have. It only matters that the red light therapy will help all kinds of pain. So when someone's suffering with something like this spondyliosis or Parkinson's disease or fibromyalgia or just, acute pain or chronic pain, any kind of pain, I've been privileged enough to see absolute miracle cases with red light therapy and pain relief. We've got plenty of written testimonials on our website, on Trustpilot, on Facebook, on Google. It's really so exciting, and it's so much potential for helping with pain. So this lady or gentleman goes on to say, which device should I purchase? So the choice of device is quite interesting, and it's quite a interesting decision to make because it's a personal decision, and you have to decide how do you want to use a device. So in this case, I'm going to assume that this person has the degenerative spondyliosis and the Parkinson's disease. With those kind of conditions, you want to expose as much of your body to the red light as often as you can. That means you need a panel. You need a large panel device so that, when you take your kit off, you switch the light on, you stand in front of the panel, and you're just going to cover from head to, down to your hips or even down to your knees, depending on how big the panel is. You're going to get a fantastic treatment in, 5 to 8 minutes with that. You can turn around, do the back side, do the front side. That's the best kind of treatment for this kind of all over systemic kind of chronic pain. Devices like this are really good for like acute pain. or pain in only 1 or 2 areas, because it's not convenient to do your wrists, your elbows, your shoulders, your knees, your hips, your back, your neck. You're just going to you're going to be there all day doing red light therapy. So the rule of thumb is get a device that matches the size of the area that you wish to treat. Okay, if you're only looking to treat your wrists or your elbows, this is perfect. If you've got, Parkinson's, where you need just chronic help all over your body, widespread help, you need to get a panel light. It's going to make your life a lot easier, and it's going to bring you benefits a lot faster. I hope that answers the question. Do you always have to be that close to the light? I think I've answered that question. I'm not sure if you heard, Janine, if you heard the answer to that. You don't always need to be that close to the light. If it's skin treatments, arm's length away is absolutely perfect. You can be a little bit closer than arm's length, but arm's length is the good spot. And if you're doing deep tissue treatments around your gut, your joints, your muscles, then you can be much closer, 2 centimeters, or even touching the skin in certain circumstances. Do you get a tan with red light? No, I wish. There is no UV light in red light therapy. It's only red and near infrared light, and these sadly do not give you a tan. You're going to have to either go out in the sun or move to a nice sunny country. Everything starts with an E is asking on Instagram, I already have the target light 2. Can it be used for guttate psoriasis? Not sure if that's a word I've never heard of, but yes, it can be used for psoriasis. All red light therapy devices can be used for all conditions. There is no certain kind of red light that's only good for pain and certain kind of red light that's only good for psoriasis. All red light therapy is good for all sorts of skin conditions. Can you use red light therapy for DVT, deep vein thrombosis? I assume. I haven't seen any studies on that. That's a great question. To directly treat the clots, I would say no. Red light therapy doesn't physically change anything. Like red light therapy won't physically get rid of the clot. It may help the body process it. The red light therapy won't mechanically do anything to the clot, but it will help the body, do its job. So assuming you're in general good health, the body should be equipped to break up clots by itself. The red light therapy potentially could assist in that process. Janine is asking, what's the difference between red light and near infrared light? Red light obviously is visible to the human eye, and it is bright red. Near infrared light is invisible to the human eye, and it's kind of a faint pink. And the two main differences are they actually affect the body in very similar ways. They just affect the body on different levels. So the red light is mostly for the skin, the eyes, the hair, everything on the outside of the body. The near infrared light actually goes deeper into the body. It penetrates through the skin, into the muscles, into the bones, into the organs, into the joints, everything on the inside of the body. They do similar things to the body. They just do them on 2 different levels. Can red light help with a poorly back? Not sure what it is, but they think it's degenerative discs. Yeah, there's a huge potential for that. Number 1 is pain relief. It absolutely can help with pain relief. Number 2 is that it can, in this instance, it can help the body rebuild, let's say, muscles or cartilage or any kind of soft tissue around that area. It's a very slow process, and you do have to have a lifestyle that is conducive to, the body repairing itself. So what I mean by that is, if you've got a poorly back, I speak from experience when I say that you unfortunately need to exercise your way out of that. And you need to find a very, very good personal trainer or a very good physio to help you diagnose what weaknesses you have in your back, which is what's giving you the back pain in the first place, and then start to strengthen up those muscles. That will take the pressure off your discs. That'll slow down the degeneration, and the red light therapy is going to help with the pain relief and help to slowly rebuild that tissue. It's a lot of work, but it's possible. I've done it. I've gone from an horrendous back, not being able to pick up a plastic chair to, lifting very heavy weights without pain. So it's absolutely possible. Okay, so Rag Trader on Instagram. I have the Target Light 2. What setting to use to improve night vision and wrinkles? It would be great to do both at the same time. So the good news is that, well, if you're talking about wrinkles on your face, the great news is the wrinkles and the eyes are generally very close together. So again, it'll just be that arm's length or slightly less away from the face, red and infrared light. Boom, that's your wrinkle treatment and your eye health, your eye care. And many people, I should say, have had fantastic results for their eyes and their skin. So that should do you just fine. Okay, Mickey, my mum has osteoporosis and recently wedge fracture in her back. I'm not sure if that's a term or if that's a grammar error. She has the wrap and the 2.0. What do you think is the best to use and what setting would be best? She has felt the red light has helped. Fantastic. So the pad is going to be the easiest one to use around her back. Okay, sorry, I'm holding that up, but I'm talking about the pad. So the pad is a flexible red light therapy wrap. That's what's going to be easiest to use because you just, obviously she can put it underneath her clothing, wrap it around her back, use the Velcro strap around the front, switch it on and forget about it and just use it. She can, stay seated, stay lying down or get up and move around. That's going to be the easiest to use. But this one is slightly more powerful, but it's trickier to use because she has to find a way to position it on her back. So she's got a lot of options. You can obviously, rest this somewhere on a table, for example. Okay, you can rest it on a pile of books. It depends on the actual condition, the mobility, the setup of the house. Is there somewhere you can easily set this up where you can aim it at the back? Can she lie on her belly and have you or someone just place it on top of her back like that? These are all options. The other option, of course, is the lamp stand that you can buy. Perhaps you can get a lamp that will hold it in place, and then she needs to find a way to get the painful area on her back close to the light. So she's got both devices, so I would just use both of them. Use the pad when she feels like relaxing and lying down. Use this when she can comfortably get it on her back. And just to share some good news about that, I've got a great client of ours who's actually become a friend now, Greg. He reversed his osteoporosis with 1 year of red light therapy. Okay. Now he is using the full panels. So he's using full body red light therapy, treating the whole of his front and the whole of his back. But he has the scans to prove it. After 1 year of red light therapy, no medication for his osteoporosis, he has reduced he's increased his bone density by 13% in 1 year, which has taken him out of the osteoporosis bracket. So that to me it's crazy news, spectacular news. We know red light therapy is very beneficial for bones. So if you've got problem with your bones, no matter where they are, get the red light therapy on it. It's absolutely stunning. How to use red light therapy for tiredness. Just all over red light therapy, expose as much of your body as you can. If you've only got the small light, the most important thing is the face and maybe the chest, because the brightness of the light will make you feel alert. That should perk you up. And actually, at the end of the day, it will help you sleep as well. And give that a bash. Can it also help with discoid meniscus after surgery? Yes. It will help with tissue regeneration. Meniscus can be very slow moving. Unfortunately, there's not a lot of blood flow in the meniscus, so it can be quite slow, but it'll be great for pain, inflammation, swelling, blood flow, nutrient delivery, all that stuff that you need to speed up the recovery of your meniscus. So yes is the answer. Let's see. Okay, Magdalena. So Magdalena is saying she cannot put the light directly on her skin because she has a painful condition. Okay, Magdalena, so get as close as you can without causing that pain. Give that a try and see how you go. You can start with 20 seconds if it's too much. You can start with 5 seconds if it's too much, and slowly build your way up and see how you go. Guy is saying, what light does the wrap use? So all our products, Guy, use the same kind of light. So they all use red 660 nanometer red light and 850 nanometer near infrared light. I'm not sure if you were on the call earlier, Guy, but basically the pad will look similar to this. So this is the red and near infrared light, but of course it looks red only because you can't see the near infrared light. This is the red light only, and this is the near infrared light, which is visible on the camera but invisible to the human eye. And what I will do, Guy, if you just give me 1 second. Oh gosh, I can't. Guy, the pad is actually a lot easier because it has colored buttons on it. So when you press the button, the first button is green, and that'll be the combo of the red and near infrared light. The second button will be red, and that's red light only. The third button will be blue, and that's near infrared light only. So there's no guessing. You can just tell by the colors. You just press the button to cycle through them. And of course, for most all pain conditions, I just recommend using the green button, which is the combination of the red and near infrared light. And Tracy is asking about my glasses. So these are blue blocking glasses. And what these do is they block the excess artificial light coming from the overhead lighting, coming from the computer screen, coming from the phones. This artificial light tends to be very high in blue and green light. Blue and green light in excess is very, very intense for the eyes to process, and can lead to, degeneration of the eyes. It can lead to tiredness. It can lead to scratchy eyes, dry eyes, exhausted eyes. And in the worst case scenario, some actual degenerative vision loss, as it were. So what these glasses do is they just filter out the most harmful of the artificial light, helps me focus, helps my eyes feel more relaxed, protects my eyes, and looks pretty snazzy too, if you ask me. Okay, Guy, I would like to chat about using it with my PDT treatment for cancer and leg ulcers. I'm not sure what PDT is. Okay. So, okay, with the leg ulcers, fantastic. Really good. It's going to really help speed up the healing of those ulcers. And also you can, I guess it is a wound. It's a kind of wound, a slow healing wound. And the red light therapy will really increase the rate at which it recovers. It'll decrease the pain. It should help the skin kind of dry out and start to heal. It'll help the collagen rebuild. And hopefully, you could get some quick results with the ulcers there. Cancer, well, he says a treatment for cancer. I'm not sure what the status is with the cancer right now. I would need you just to refer that to your doctor, Guy. I can't make any recommendations around cancer. It's a very sensitive subject. I'm not qualified to make any suggestions there. But I do know the NHS is actually in the middle of trialing red light therapy for pain relief for cancer patients. So, oh, there we go, photodynamic therapy. So you're already having photodynamic therapy. Well, if you're already having photodynamic therapy, I don't see why you can't use red light therapy as well. It's a type of photodynamic red light therapy, I suppose. I hope that's useful, Guy. You can reach me on email, Guy, if you want, and we can explore this together a little bit more. Brian is saying, can you use light through your clothes? You can. The near infrared light will go through clothing. The red light, not so much, but it's better just to be bare-skinned. If you're bare-skinned, you're just going to get the absolute best, the best of everything. You're going to get the best results, the best penetration, and the best experience. So I recommend, if possible, get your kit off Brian and make the most of your red light therapy. Guys, that's it from me tonight. I have to shoot off. Thank you everyone for joining. This will be on YouTube within a couple of days. There's a bunch of other, Q&As we've done on YouTube, and all the questions are listed out. So if you go and look at that, you can look on the questions and just click on them, and they'll take you straight to that part of the video. It'll be the same with this one. Thank you so much for joining, everybody. We'll be back next week. Keep your eyes on the emails if you wish to join. Thank you so much, everybody. Good night.